But we don't know how much of this is genetic and familial and how much of it is environmental and postural until we go through this process of trying to optimize everything around it to see what's left over. G'day and welcome back to the channel. So in today's video, I want to show you how you can fix an increased lordosis or hyperlordosis. And what I want to do in this video is I want to give you a broad perspective that I've come to understand as a physio as to what the underlying cause of most people's hyperlordosis may be, and then offer up 2 or 3 exercises that you can hopefully put in place to undo those effects and then reclaim a normal low back posture going forwards. So before we get to these exercises, obviously, the first point that I want to touch on with any sort of increased lordosis is that it tends to have a very clear connection to what your pelvis is doing. So for a lot of people, if you have an increased lordosis where the curvature of your lower back curves inwards more than maybe the next person does, that is often very closely connected to an anterior pelvic tilt, in that as your pelvis tilts forwards, it increases the curvature of your spine. If your pelvis tilts backwards, it tends to flatten the curvature of your spine. So there are obviously some genetic cases and some instances where you may just have a lordosis because that's what came before you, but we don't know how much of this is genetic and familial and how much of it is environmental and postural until we go through this process of trying to optimize everything around it to see what's left over. Because if you're getting low back pain or pelvic pain and you've got some pelvic floor dysfunction or some hip pain or something else going on, and someone's mentioned to you that a hyperlordosis may be part of the problem, that in of itself may actually be a symptom of something else as well. So we need to make sure that we're going through this process to see what you can start to sort of bring down and tear down and see what's left over going forwards. So as I was saying, when we're talking about a hyperlordosis, we're often having a conversation about an anterior pelvic tilt. And from what I find clinically, one of the main reasons why a lot of people can get stuck in an anteriorly tilted position, which is exacerbating that lordosis, is because the front of the hips are tight. The first thing that we need to talk about here when we're trying to resolve this is an exercise that will address some of the deep hip joint capsular stiffness that we tend to accrue by being stuck in that 90-degree hip shape all the time. It requires using a power band or a jump stretch band secured to something pretty stable. What we want to do with this is we want to place the band and bring it all the way up to the top of your thigh, underneath your butt cheek, as high up towards that hip crease as possible. I'm going to come up into a bit of a high kneeling position, come back as far as you feel comfortable, extend that hip as we lunge forwards. So the front of the hip can become brutally tight just from sitting all day in this sort of hip, 90-degree flex position. So we want to put in some extension as far as you feel comfortable, get the band to pull forwards to open you up, making sure that you're not leaning forwards or bending through your back too much. We want to make sure that you're up nice and tall. You're just translating your hips forward as far as you feel comfortable. Feel free to translate into different directions depending on where you feel you need the best or the most attention with this capsule. You can also play around with where your back leg is positioned as well, and just oscillate in and out of the end range of this to really allow that capsule to give over time, and obviously do that on both sides. Now, the important thing about this is what you should then find is that that it's easy to get back into a more neutral pelvic position because we've taken away one of those hidden handbrakes that then allows you to reposition yourself a little bit better. One of the best exercises I've ever seen to improve the function of the front of your hip and thigh is the couch stretch. Now, I'll link to a video I've done previously on how to do the advanced and beginner versions of this. Ideally with the couch stretch, you will do this on a chair, but for the purposes of this video, this is a more advanced version. I'm going to do it back up against the wall. All it requires you to do is to get your knee back into the corner of the wall or a chair. We want to get you back up into this high kneeling position again. Now, just be forewarned that this can be a brutal exercise to do if you haven't done it before. This will expose all the years of sitting that you've done in your lifetime. It may be challenging for you to get into this position for a long time. So I want to make sure that you are in a position that you feel very comfortable with. If just getting into the starting position is enough for you, try and breathe your way through that. Stay here for as long as you feel you need to. As this tissue at the front of your hip starts to give, you will feel more comfortable eventually coming more and more vertical until you can reach this vertical position without wanting to vomit and pass out. But you should feel there's a whole bunch of muscular tightness at the front of the hip, down through the front of the thigh, but we want to address so that it's not consistently pulling your pelvis into an anteriorly tilted position. So again, much like the hip flexor stretch, We can change the direction that you're stretching. So instead of being straight forwards, you can twist a little bit one way or the other to see where the best version of your stretch is. You can change the position of your shin. You can make it a little bit more, maybe instead of being maybe 12 o'clock, you can make it sort of 1 or 2 o'clock, just to really bias that internal external rotation a little bit more. But what I want you to do here is take a deep breath in, and then gently tense up all your muscles. So squeeze your butt cheek, tense your thigh, push your foot back into the wall. Again, whatever position you're in, if you're here, it's the same idea, pushing back in there. Hold that for about 5 seconds, then breathe out. And what you'll find is everything will give a little bit, and you might find you can then go a little bit further and further and further. But ultimately, what we want to see you do is you should then feel like you're not as anteriorly tilted through that pelvis as you would have been previously. So clinically, what I find is we need to make sure we're going after some of that hidden sort of tightness and restriction at the front of that hip that's drawing the pelvis down and sucking your back into more of a hyperlordotic position. As we can normalize that pelvis a little bit more, you should find that that back does neutralize and normalize more so than it would have otherwise. Now, the next thing that I want to touch on with this is if you're managing your sitting load and hopefully standing a little bit more, sitting less, and you're undoing some of the restrictions at the front of the hip, that should give you a really clear path to conquering this lordosis as quickly as you're going to. Now, the other thing that we need to talk about is we need to make sure that you're able to reposition your pelvis on command and engage the right muscles at the right time to recondition your brain and recondition the motor patterns of that area to remember and value that new pelvic and lordotic shape. So one of the quick tests that I think is really important to go through with this is if you are to stand up and squeeze your butt cheeks, and what you'll hopefully notice, and you might see this with me a fraction, is when you squeeze your butt cheeks, that reorientates your pelvis into a really good position. So ideally, you should find that when you squeeze your butt cheeks, nothing changes. So if you find that you go from this position and you squeeze your butt cheeks and you can feel and see that pelvis tilting backwards, that's a surefire sign that you're spending way too much time in this anteriorly tilted shape. In a perfect world, and you might see this once you've done those 2 hip stretches, is when you're in a good position and you squeeze your butt cheeks, you may not feel like your pelvis changes too much at all in terms of its orientation. Ideally, that's what we want to get to. The other thing that's really important to understand is that when you screw your knees outwards, so if you plant your feet on the ground, screw your knees out, this will engage a lot of the muscles of your hip. That external rotation creates a lot more stability at the hip and allows you to maintain a much better pelvic orientation than if you're a little bit sort of floppy where you dump forwards with your pelvis and your knees will cave in. So what I want to get you to practice in terms of to develop this musculoskeletal pattern is we can practice all the good things that we want your pelvis to do and your low back to do in the form of a squat. And I find a great way to do this is with a booty band. So we're going to get this band, and you can use any resistance band. You don't have to do this if you don't want to, but if you want to place the band above your knees, and essentially what we want to do here, in terms of trying to teach your body how to reorientate itself, the first thing I'll get you to do before we do this is to squeeze your butt cheeks and externally rotate your knees on a fixed foot. So again, we don't want your knees to rotate outwards and your big toes to lift up. We want your feet planted. We want your knees to rotate outwards and your butt to squeeze to put your pelvis in a good position. Now, to try and help maintain this good position, what we want to do next is we want to then draw your belly in towards your spine to hopefully stabilize that shape. So you've got a stable hip, stable trunk, everything's integrated really well. And then the challenge for you is to maintain all of that whilst you squat down. So if you feel like you come down and you start to lose your pelvic tilt a little bit, or you start to squat down and you feel like you start to lose that bracing mechanism of your spine, start again, squeeze your butt cheeks, rotate everything out, draw your belly in, and then just squat down as deep as you feel you can control it, even if it's a small squat to start with, because then eventually what you'll find is you will be able to stay in that good position consistently. And by fatiguing your body in this way, by fatiguing your quads, your glutes, and your trunk muscles, your body will then start to feel more comfortable reproducing that shape day to day without you thinking about it. So not only do we need to free up some of the reasons why you're being dragged out of a good lordotic position, but also address the standing shapes. We want to reprogram your brain by engaging the right muscles at the right times to hold that position and make it feel more normal going forwards. Ultimately, as I said, a hyperlordosis is often a comment or a conversation about what your pelvis is doing. But if you can just start with that fundamental first phase, there are a whole range of other things that we talk about in terms of, excuse me, decreasing sort of the low back tightness and stiffness, some abdominal weakness and other things like that. We can do some core exercises and some back stretches and hamstring stretches and all these other things as well. But I find unless we get to potentially the number one priority in my mind in terms of the position of your pelvis and the anterior tightness at the front there, you're going to have to keep doing those until we get to the bottom of why this is there in the first place. So again, I hope that was really interesting. I hope that was helpful. Please remember that a hyperlordosis and an anteriorly tilted pelvis are often one and the same. I know there are instances where that may not be the case for you, but just make sure that you're not dealing with some of these very hidden issues as well. So I genuinely hope that was helpful. I hope that gives you some perspective, at least based on what I find clinically with my patients. With that being said, I hope to see you in the next video. I'll see you soon. Bye.